today's webinar is on navigating systems. My name is Damon Wonky. I am the founder and CEO of Wonky Consulting. I'm an entrepreneur. I got my undergraduate degree in Management Information Systems and my MBA from Western Washington University. I'm an IT accessibility expert. I do a lot of disability advocacy at the national level. I'm a member of multiple nonprofits. In my free time, I love to travel and ride my bike, and I help sell for poverty. So, a little introduction on why I have to navigate. I have a disability, and due to my disability, I have encountered many pieces of the system. I want to work, but I also need in-home care in order to work. For most of my career, working too much eliminated my in-home care benefit. And the system is broken. It is old and needs upgrading to create a default system that allows people with disabilities to be successful in the workforce. So today I am going to share my experience with navigating various systems. So let's first start out with supplemental security income SSI. So as you know, SSI is a government program meant to assist disabled people from being in poverty. Right now, the SSI amount is $7.94 a month, and after $85 earned, for every $2 I would earn SSI, they increase my income by $1. When I was on SSI, I was only able to save $2,000. I was on SSI starting at 18 when I was a college student, and I used the student earned income as school for the many internships that I had. The school allowed an SSI recipient who was a student and under the age of 22 to make $19.30 per month up to the cap of $7,750 per year. They are not counted towards the SSI to determine the SSI payment amount. So to get on SSI, I had to prove that I was unable to work. But then I had to try to navigate the SSI work incentive to try to have internships and jobs while keeping my medical. The resource limit made paying college tuition difficult because I had to pay one lump sum of over $2,000 each quarter. Using the student earned income as schooling, I was able to earn more up to when I turned 22 because I was in college. But I didn't graduate college at 21. Like most colleges, I was still in school after age 22. So why is the age limit only 22? I asked this question to someone high up at Social Security a while back, and their comment is they pulled it out of thin air. So now let's go on to Medicare. Medicaid is a state-run insurance program and is the only insurance program that covers in-home care without dealing up with the home bill. Medicaid also covers more medical needs and copay. Medicaid has a different name in each state. And Medicaid is typically a state program for people with low income. People that qualify for SSI automatically qualify for Medicaid. And people with disabilities that are working can qualify for Medicaid up to a certain income amount in various states. So, a little on my Medicaid experience. So, in-home care leads to my ability to work, what leads to my ability to pay more taxes to the government. My Medicaid and in-home care surveyor were cut off when I moved to Virginia to prevent my career after earning my MBA. This because I made too much money according to the state threshold in Virginia. In turn, this lowered my quality of life because I had to pay out of pocket for all my in-home care, and because of that, I limited my in-home care to the bare minimum to get by. After 2 years of finding that this was not a good situation, I talked to my employer and was able to move back to Washington State from the Washington DC area to work remotely. In order to qualify for Medicaid in Washington State, I had to choose to cut my work out down to 4 days a week instead of 5 days a week, because I would make more money not paying for in-home care out of pocket working 4 days a week than I was working 5 days a week. Then I was able to use my story to advocate for Washington State to get rid of the income limit for in-home care. Luckily, this passed a couple years ago, so now I can make as much money as I can and pay a percentage of my income and my Medicaid premium without any cap. Unfortunately, there is still an income limit for qualifying for in-home care in most states. So I hire and manage my own personal care center to get my in-home care. In-home care allows me the ability to go to work. I can't get higher my PCA easily. They must be higher for Medicaid. This hiring process can take 1 to 2 months, and my PCA are also required to take a 70-hour training. And the training, they never tell me when it's going to be offered. So it's very difficult to get new personal care centers through the hiring process in order to start work and enrolled the training in the first 120 days of employment in order to continue working. For the first 2 years in college, I got stuck hiring my PTA for a care agency, which added another layer of red tape. Though I could hire people very quickly, I do not have the ability to manage my care schedule directly, even though I can manage my PTA schedule better than the agency could. So the vocational rehabilitation. So when I started in DI high school, I got into the Western Washington University, and I was told by my DI campus that there was a new policy that I can only go to my local college. Luckily, my career goal was to combine computer and business, and the local college did not have the upward, making it so I could go to a state university. At the public state university, I covered some of the costs. During my first year at college, I decided to switch my case to the VR orbit near my university. And at that point, I found out that the new policy did not exist, and that they were supposed to be paying for all my tuition, these books, and supplies. I'm really glad I planned for the orbit because it saved me a lot of money. And I was able to get VR to support me to not only get my undergraduate degree, but also to get my 1-year MBA degree, which helped me get into the career I'm in today. So FBI. The FSDI is a monthly cap benefit based on the number of work credits you have earned in your age. To qualify for FSDI, a recipient needs to earn enough work credits. In 2021, one credit is earned for every $1,470 in wages, and a person can earn up to 4 credits per year. Before age 24, a recipient only needs to earn 6 credits in the last 3 years of work. The work credit rule allows young people younger than age 24 to easily qualify for FSDI, working at least 1.5 years of the last 4 years. So this is what I did. I earned enough work credit before age 24 with my internship that I qualified for FSDI. When I applied for FSDI, not FSDI, sorry, I was told I did not qualify for FSDI because I was already on FSDI. Come to find out, they were incorrect. I had enough work credit in the last year working multiple jobs and internships in college. And at the end of this with cerebral palsy, I met the definition of disability according to Social Security standards. At that point, I had to convince the Social Security Administration that I did in fact qualify for SSDI by appealing their decision and pointing out why I did in fact qualify for SSDI. The minute I received my full SSDI amount, benefit amount in people, I met the income threshold per month. The name of this threshold is Substantial Gainful Activity, SGA. This SGA threshold in 2021 is $1,310 for people with disabilities. People who are blind have a higher threshold. When I began receiving SSDI, I was provided with trial work period where I could try out the ability to work. This worked out really good with my summer internships because I was able to earn as much as I could without there being a threshold and still get my full SSDI benefit. So now let's move on to Medicare. Medicare is an insurance plan for people with disabilities and senior citizens. It is managed by our federal government, and Medicare typically cover more than Medicaid, but they're not covered in home care. Medicare had two parts. Part A is hospital insurance, and most people do not pay for Part A. And Part B is medical insurance. Most people pay monthly for Part B, but for someone like me, if someone is eligible for Medicaid, well, Medicaid covers the person's Medicare premium. This means that I only have to pay my Medicaid premium and not both Medicaid and Medicare. After 24 months of receiving SSDI benefits, a person becomes eligible for Medicare. So all of this made insurance interactions very complex. While I was on Medicaid, I was still eligible for both Medicare and Medicaid. After I moved from Washington State to start a job in Virginia, I signed up for the health insurance that was offered through my employer because I was under the impression that the private health insurance is always primary and Medicare is always secondary. Unfortunately, I later learned that because my employer was small, Medicare would continue to be my primary insurance, while my employer's insurance would be my secondary insurance. This arrangement meant that my employer insurance did not cover many of my healthcare costs, even though I was paying a monthly premium for both Medicare and my employer insurance. So then, after I moved back to Washington State, I qualified for healthcare for worker with disabilities, HWC, Washington State Medicaid buy-in program. As I stated before, Medicaid covered my Medicare premium, so I did have to cover my HWC premium. For me, navigating the different healthcare options has been complex, and I have learned a lot about how they all interact. To the point that when I worked in Virginia, even though I was no longer on their healthcare, I was appointed the chair of the company healthcare committee because I learned so much about insurance interactions. I now receive insurance from my employer, and because they are a large employer, they are my primary coverage. My three insurances typically coordinate together to ensure that costs are covered in the correct way. Every time I visit a provider, I provide them with all three of my insurance cards, and I give it to them in the correct billable order to ensure that they know how it is properly built. So now let's talk about able account. So what is an able account? Able accounts are tax advantage savings accounts for individuals with disabilities and their families. It was created as the result of the passage of the Stephen Beck Jr. Achieving a Better Life Experience Act of 2014, better known as the ABLE Act. You can only have an ABLE account if you acquire your disability before age 26. So since I acquired my disability at birth before turning age 26, I received benefit under both FSI and FSDI. I automatically qualify for an ABLE account. Any earnings in the account are not taxed. And ABLE account funds are excluded from resource limit of programs like SSI and Medicaid. I was really excited about the idea of an ABLE account, and I tracked the legislation until it got passed, and was ready to open an ABLE account the first day the first ABLE program launched in Ohio. Individuals can open an ABLE account in any state. So even though I lived in Washington State, there was not an ABLE program yet in Washington State. So I opened it in Ohio. Later, when my state started the old ABLE account, I transferred my ABLE account from Ohio back to Washington State. By the time I opened my Able account, I no longer had any resource limits on my benefit except at the $2,000 limit. So I chose to open an Able account so I could invest money to cover any unforeseen disability costs that might come up. I can spend money saved in the Able account on qualified disability expenses, which is designed very broadly. So any expense as a result of living life with cerebral palsy counts, and I can even cover my housing costs with my Able account funds. The Ticket to Work. Social Security Ticket to Work program support career development for Social Security disability benefit group ages 18 through 64 who want to work. I chose to assign my ticket to the employment network called AAA Chart. AAA Chart is an employment network that can reimburse you for impairment-related work expenses when you are earning more than the FCA threshold. But I use AAA Chart to reimburse me for some of my disability-related work costs. For example, I use the funds to help pay for my PCA out of pocket when I lived in Virginia. I was very lucky to find a mentor to help me navigate government benefits while I was in college, and this is a resource that many people with disabilities do not get to have. Having mentors and being a mentor has been a big part of my life. Many mentors from many different places have invested in my journey. I have had the ability to glean off what they do to gain experience myself. Due to seeing my growth when being a mentor, I now mentor other people with disabilities, and I'm also involved in nonprofits that provide resources to help people with disabilities navigate government systems. Now, members of the disability community come to me when they need advice on navigating benefit systems, and whenever possible, I make it a priority to help them get through the navigation that they are currently working on and answer any questions that they might have. Self-employment and navigating systems. DR may be able to help with startup equipment costs with self-employment. Self-employment does apply to FSDI Medicare tax. FSDI and Medicare only count your net income allowing for more income flexibility. There are pathways for hiring people with disabilities, which provides an incentive to hire other workers with disabilities. Those of us who need in-home care are only granted so many hours. If I am my own boss, I have more flexibility on when my personal care attendant help me. If I needed my personal care attendant to drive me to work, I may not have the hours available for them to drive me to other appointments, such as getting my leg braces fixed. So some final thoughts on my journey of navigating systems. Navigating benefit systems can get very complex. Sometimes even employees of the system do not know the correct rule. So those strong self-advocacy skills are must. Self-advocacy could even get rules changed, like I did in Washington State, helping to remove the income limit for the Medicaid buy-in program. Mentors that know the system are very helpful to have. And when you have the knowledge to navigate a system, it is important to pass that information on to others. I hope you enjoyed this webinar and feel free to email me with any questions.